Hey, I'm Dr. Joan Iamtu, LoveThatFace.com. I'm a cosmetic facial surgeon, double boarded. I'm in Richmond, Virginia. I do cosmetic facial surgery from here to here, and I don't do boobs, bellies, or butts. I have over 500 YouTube videos and almost 24 million views. I love doing this. I love talking to people all around the world. And some of my most watched videos are those that have to do with common complications after facelift surgery, after laser, after various procedures. And today we're going to talk about common complications after cosmetic blepharoplasty or eyelid surgery. And I love doing eyelid surgery. I've done over 7,000 eyelids over the last several decades. And it's one of my favorite procedures, and it's usually very straightforward. But any surgeon anywhere will tell you that it's possible to have complications when you do this surgery, or any surgery. There's no such thing as a surgeon. If a surgeon doesn't see any complications, then they're not busy, okay? And fortunately, most of these things are very minor, and actually, a lot of them aren't even complications. They're what we call sequela. And a sequela means it's something that can happen normally when you do a procedure, okay? But patients kind of look at them as complications. And they can be real easy things from bruising to very, very rare things that could actually impair your vision. So we're going to talk about all these. I'm going to do a little narrated PowerPoint presentation and walk you through this. Okay, so we're going to talk about these common complications. And if you've had blepharoplasty surgery and you're worried about something, this may be helpful. And I want to say that most of these things are pretty simple and they clear up on their own. So let's talk about things that happen early after your surgery. So some people could wake up in their recovery room and they have pretty severe eye pain, feels like that there's sand in their eye. Well, they may have experienced a corneal abrasion during their surgery. So, the eye, the cornea is very sensitive, and sometimes it can be abraded by instruments or protective shields, or sometimes patients will rub their eye, even though we try and prevent that, and scratch it. And what you're seeing here is we put a special dye in the eye, in that green area above the arrow represents an abraded cornea. So they're very painful. The great news is they heal almost overnight. What we do is we put a patch on the eye. We actually do two patches. We do a half of a patch and then a full patch. So there's a little bit of pressure so the patient can't blink and further scratch their eye. And usually that'll heal overnight. The cornea heals very rapidly. Nausea and vomiting. So this patient is shown day after or the day of lower eyelid blepharoplasty with a transconjunctival approach, so the incisions on the inside of her eyelid. But she had a little reaction to anesthesia, which happens occasionally, and she had nausea and vomiting and was throwing up, and you can see that she has this swelling from that. Again, I'm talking about things that happen very early on after surgery. This also can happen from some people get nauseous taking pain medicine. We do give all of our patients an antiemetic, in other words, an anti-nausea pill, Zofran, that you can dissolve under your tongue, because we do not want people throwing up, increasing their blood pressure, and increasing the chance to bleed during any cosmetic surgery, especially eyelid surgery. Okay, here is a patient that is maybe 48 hours after upper and lower eyelid surgery and lower laser skin resurfacing on the lower lids, and she just has an abnormal amount of swelling. So it's very rare, but once in a while you can see somebody that really does swell a lot, and a lot of this would be from the laser. Most people don't swell this much, but again, some people do. Here's a patient that came in a couple days after her eyelid surgery, and she was really miserable and swollen. And this is really unusual. When you see this kind of swelling in the upper picture, this is usually an allergic reaction. And it turned out that, against our advice, this patient was putting Neosporin on her eyelids, and she was allergic to it. As a number of people are. And when we discontinued the Neosporin, almost immediately things got better and that swelling resolved. Okay, double vision or blurry vision. Now, these are things that you can see initially after surgery, and it's just from swelling. So the eyes are such a finely tuned system, and they're like binoculars. And if you ever look through binoculars and you have the left or the right side in focus and the other side out of focus, it looks funny. So just swelling can have temporary double vision or temporary blurry vision. And this can last from hours or in rare cases a couple of days. If you have extended double vision or blurry vision, then you certainly want to talk to your surgeon. But that is pretty unusual. It's usually just a transient situation. Ecchymosis is a fancy word for bruising, and this is extremely rare. Especially, I only use lasers for my eyelid surgery. I don't use scalpels or anything that would cause more bleeding. And so it would be very rare that we see this, but there are some patients that may be on aspirin, they didn't stop it when they were supposed to, or blood thinners, or just some people that overdo it, or every once in a while somebody just is really sensitive and they'll get bruising. So it's possible to get a black eye like this. We hardly ever see it in my practice because of the use of lasers. Okay, now there are some things that can happen with eyelid surgery that can be extremely emergent and extremely serious. And thank goodness they're extremely rare. So if you bleed behind your eye and there is no place for the blood to escape, it can push on the eyeball and increase the pressure inside your eye. And this is called a retroballbar hematoma. It is a very rare, excuse me, very rare situation, and it's something like 1 in 250,000 patients, and having vision problems after that is something like 1 in 450,000 patients. But your surgeon has to be experienced enough to treat this immediately if it happens. Again, this is something that is extremely rare. Most surgeons will never see this. Um, Surgeons like myself who did a lot of trauma in their training, we used to see this with assaults, automobile accidents, and various facial trauma. But to see this with cosmetic blepharoplasty is very rare. Kind of a general thing um, that I tell patients that if they can see light and count fingers, they're doing okay. All right. And if somebody would have severe swelling like this from bleeding, if they can see light, if they can still see the color red, they can count fingers, they're okay. But again, if you think your pressure is going up, if your eye is bulging or you have active bleeding, then it's a scary thing, and you certainly want to see your surgeon. In the very rare instance that someone would have a retroballbar hematoma, your surgeon needs to be trained in lateral canthotomy, where you make a cut horizontal and a cut vertical to release the pressure on the eyeball. So hopefully all doctors that perform blepharoplasty understand that procedure. And this would be an emergency procedure. So if you had swelling behind your eyeball and you were bleeding and your eye was protruding forward, and when that happens, the eye feels very hard and it protrudes forward like a ping pong ball, then that is an emergency. Again, this is extremely rare. So if you have a little bit of swelling around your eye, if you have any questions, you always consult your surgeon. But this is so rare, but I do feel it's important to mention. Again, um, there are people that have minor bleeding that still looks kind of nasty, okay? And um, these usually, this is very rare as well, but these are usually people that don't listen, and they, while they're recovering, they didn't look at the directions, and they say, well, I'm home for a week, I might as well go out and, trim my yard or clean out my attic, and it's usually from either taking something that makes you bleed or too much activity in the early days of your surgery. Here's another situation we see from time to time, And this is called subconjunctival ecchymosis, okay? So subconjunctival means it's under the conjunctiva, which is the clear membrane that's over your eye, protective membrane. And all this is bleeding or bruising that shows up under the conjunctiva. Now, it looks really creepy. So when patients see this, they may get scared, but it's harmless. It's just bruising. And again, you see this once in a while. Some people simply bruise more than others. It can take a while to go away. I mean, it sometimes goes away in 4 or 5 days, but it can last a couple weeks. And really, the way we treat it is just put heat on there and rest. We also, once again, you'll notice so many of these things that I'm talking about that have to do with bleeding or bruising occur when patients are being overactive during their recovery. I want my patients to be a couch potato for 48 hours, and then they can they can walk around, they can go to the mailbox, they can be on their computer, but they can't do any heavy bending or lifting. Generally, by a week, for most patients, they can resume back to what they do. So, you know, sometimes it's the fault of a healing, and sometimes it's the fault of the patient. Okay, so but not to be worried about this. And again, I'm going to say this all throughout this talk, that if you have a condition or a problem or a complication or something you're worried about, consult your surgeon. This is to serve as a basic guide, and subconjunctival ecchymosis is a harmless situation. Okay, here's another thing that really kind of scares patients. We see this once in a while, especially if we're doing bigger procedures, and this is called chemosis. And what this is swelling of the conjunctiva, what we call the bulbar conjunctiva, which is the coating around the eye, the protective coating. And what happens is fluid gets in here, and you get this, what patients will describe as a blister. It doesn't hurt, but it looks really creepy and really kind of scares patients. Okay, again, this is in and of itself is a benign situation. It'll go down. Sometimes it may go in a couple days, but sometimes it can last for a while. And to treat this, we may put the patient on steroids. We recommend hot washcloths, and it's usually just swelling related. But I would say this is when a patient sees this, they kind of get scared. Okay, Lagop Felus is the inability to close your eyes. Now, if this was a permanent situation, that would be a big problem. But when you tighten the eyelids and remove excess tissue and remove skin, which I don't do usually, I laser the skin, but it can make everything so tight that temporarily the patient couldn't close their eyes. Now, to have somebody like this patient, that's pretty rare where you can't close your eyes that much. But all we do is kind of stretch this a little bit and the eyes will close. Um, there are cases where a surgeon might remove too much skin and this would be permanent. Well, that's a big problem because it could cause dry eye and corneal damage. But when you're doing laser or other procedures, you might see this just for a couple days. And if we do have this, usually we'll just stretch the eyelid. The surgeon and I will recommend to my patients some stretching exercises, and sometimes it'll correct that on the spot. So it would be extremely rare and a problem to have permanent inability to close the eyes. So that's a rare situation as well. But I tell my patients, and it's in my consent and my post-op instructions, if this happens temporarily, don't fret about it because it's something that can happen after blepharoplasty to have minor inability to close your eye. Okay, now this is a really important thing here, and it's important for patients and important for surgeons. As we get older, or even young people that wear contact lenses or maybe just have loose eyelids, this has to be diagnosed before surgery. So this patient has extremely loose eyelids because of her age. And if you pull that eyelid down with your finger, it doesn't go back up. Okay, it stays retracted, as you can see here on the right side of the picture. So you can imagine if you were to cut skin away or laser that skin, it could permanently pull that eyelid down. And that is a problem functionally because you get dry eye. It's a problem aesthetically because it obviously looks terrible. So hopefully your surgeon has tested you to make sure that you don't have laxity in your lower eyelid. It's really important. Um, and again, people that do eyelid reconstruction, like oculoplastic surgeons, they'll tell you that they see patients, a lot of them, that have had too much removed during eyelid surgery, and they have to go back and fix this, okay? So it's very important. I pay a whole lot of attention to that situation. Again, you can have this appear sometimes, and it's very transient. So here's a patient that I did. And in this particular patient, we did take some skin off the lower lid, which I usually don't do. And he's shown like the day after surgery, or maybe 5 days after surgery on the left, and you can see that you can see the white of his eye. You're not supposed to see that. And so with just healing and a little bit of massage, I think maybe this was 10 days later, it comes back up to normal. So the lower part of your lid usually just covers the little circle, the limbus of your iris. So you can get this temporarily and it goes back to normal. And again, here's a patient before. This is, I don't laser dark skin patients. So sometimes I will remove a little bit of skin. And this is a couple days after surgery, maybe 5 days after surgery. And the patient does have significant retraction. But again, once the swelling goes down, it returns to normal. So just because you see this in the early postoperative period doesn't mean it's going to be permanent. So preoperatively, when I diagnose somebody that has loose eyelids, lower lids that are floppy or loose, then I do a procedure called a canthopexy, where I tighten that eyelid at the same time as their cosmetic surgery. Okay, so it's very important. And for novice surgeons or young doctors or inexperienced doctors, um, they probably don't want to treat patients that have lower lid laxity because it can be very problematic if you don't have a lot of experience with it. So if you have patients and they have lower lid laxity, then you may want to refer them to somebody that has a little bit more experience that can tighten that eyelid. Because once again, if if your eye doesn't close or if it hangs down, it's a functional and a cosmetic problem. Next, we're going to talk about ptosis, which is it's a Greek word, and the P is silent. And ptosis is something that is drooping. It's also called ptotic. So this patient, if you look at her eyelid, her right eye, okay, let me get my laser going. If you look at her right eye, you can see that there's space above her pupil and her eyelid. Whereas on this side, it's almost touching the pupil because her eyelid is drooping, and that's called postoperative ptosis. And again, I've never seen that to be permanent in the eyelid surgery that I have done, which is almost 7,000 eyelids. Here's another patient after surgery and then a couple weeks after surgery. So usually this will improve by itself. Wound dehiscence. Dehiscence means that the incision has pulled apart. And sometimes the stitches can come out or dissolve early, or the patient just may have poor healing tendency. And, when they close their eye, it could split the incision open. And as bad as this looks, usually you don't even have to do anything to treat it. It'll heal by itself. But if it pulls apart a lot, such as this case, then we'll go ahead and um, prep the area to sanitize it, and then maybe put a couple more stitches in. But that happens. You might see that once a year, once every couple of years. More common on male patients. And again, more common on patients that don't listen and they're out there trying to do too much. Revision surgery. So all doctors do revision surgery on their own cases unless they hardly operate. If you do 2 eyelid cases a year, you probably don't do any revision surgery. If you do 500 cases a year or 500 eyelids, then you will do revision. One thing about the eye, okay, I mean, when I'm teaching doctors, I always use the analogy, you have 10 fingers, 10 toes, 32 teeth. You only have 2 eyes. All right? You have to be extremely conservative with eyelid surgery. This is a great example, not this picture, but just eyelid surgery in general, that, if you overtreat, like I showed you in some of these pictures where you can't close your eye or the lids are pulled down, or it can cause serious problems. It can last a lifetime. So a good eyelid surgeon is conservative. When you're conservative, from time to time, and I'd say I think I do about 450 eyelids a year. Um, I'll have 1, 2, 3 patients maybe that have a little skin left over, and I will go back and frequently under local anesthesia and just take off a little bit more skin. It takes about 10 minutes. I don't charge for it, but I have had over the decades, I've had cases where I had to go back and do a little bit more, but I've never had a case where I took too much off and the patient had a permanent problem where they could not close their eyelids. So, nobody wants to have revision surgery, but for a conservative doctor, and that's what you want with eyelids, sometimes it happens. And I talk to my patients about this, and they all understand. Now, another situation, one of the most common things I see after eyelid surgery, patients come back, a week later, I use dissolvable stitches, and they'll say, I've got a scar on my side of my eye by my crow's feet. And this is a situation here that I want to explain. The eyelid skin is some of the thinnest skin on the body. It's a fraction of a millimeter, 0.2 millimeters, okay? And a millimeter is the thickness of a dime. So when we make incisions in this skin, it heals quickly and it heals very naturally. But when you transition, this is actually, part of the forehead here, or the temple, and that's a lot thicker skin. And you can see the difference between this skin and this skin. So it's just going to take longer for this to heal. And we try and put this little incision here into a natural wrinkle like somebody's crow's feet where it'll be hidden. But patients will complain about that because that's one of the first things they see, because this is healing nicely and you still have this. I'd say 98% of the time it heals fine. And if it doesn't heal the way we want it, we can do a little steroid injection or we can laser the area, but most often you don't have to do anything. But just understand that, as I showed in the previous picture, that area is going to take longer to heal. Suture cysts, and this is one of the most common things that we see, and believe it or not, I couldn't find, these are all my pictures that I'm using here, and I could not find a picture of suture cyst. And when we put stitches in, and I use dissolvable stitches, this happens to be a stitch that has to be removed, and we do that on sometimes for certain patients. And but anyhow, when you have a stitch here and you have a little like a baseball, when you look, it's called a baseball stitch. Sometimes you can get, especially with dissolvable stitches, you can get a little inflammation there, and you get a little bump, like a tiny little BB, and you can have 1, 2, 3, 4. You can have several bumps across your eyelid incision, and these are called suture cysts. They're probably really not a cyst. It's just a little inflammatory nodule. Usually they'll go away by themselves. If they don't, we just take a little electric surgery, radio wave surgery tip, and zip, zip, and melt them down, and they go right away. Hypopigmented scars. So these are patients that you can see that their scar kind of turns white. And this just has to do with healing. This can happen with a laser incision, a blade, scissors, anything. And it can happen anywhere on the body. One good thing about eyelid scars is you don't see them, excuse me, you don't see them when the eyes are open, okay? So, unless you're worried about somebody looking at you in your sleep, having a light scar just is not a big problem. And even sometimes they'll look white at first, and over time they will repigment to more normal color. This is called an A-frame deformity. Let me explain. So an A-frame is when you're doing roof construction, that's an A-frame. So in other words, it comes to a peak like the letter A. All right? And everybody, or almost everybody, has a notch in their, if you looked at a skull, looked at a skeleton, there's a little notch right here. It's called the supraorbital notch. And some patients have this where you can see it, but it's obscured by the excess skin and fat. And when you take that skin and fat away, you see these little notches. All right. So it's important for surgeons to lift up that skin and examine it to see if a patient does have a visible notch, because if they do, they're going to see it after their surgery. And you don't want the patient to think that you caused it. So it's something that they had in the first place. Now, having said that, if a surgeon is too aggressive, and we don't remove uh, the central fat pad. There's a fat pad that covers this area. We don't remove that, or I don't, during blepharoplasty surgery, unless it's an exceptional large fat pad. And if you over excise fat in that region, you can cause this type of deformity or hollowing. So sometimes the patient already has it. Sometimes it could be a problem or a complication from over resection. Again, experienced surgeons are well aware of this situation. This is a really rare complication, and this is called medial canthal webbing. And what happens here, this area, anytime on the body, and all surgeons know this, when you make an incision on a concave area, whether it's the back of the knee, the front of the elbow, if you're making an incision over an area that is sunken or depressed, it can heal with this webbed deformity. And you can fix these things, but they're very difficult. So you definitely want to avoid them. You know, once in a while, some patients just heal and start to get some thickening there, and we'll put steroid in there or release that scar a little bit. But this is why we never carry our incision past where you see my laser mark right here. In this little depression here, okay, we call that the multi-contoured area or the lateral nasal depression. You don't want your incision going here. This is not my patient. And whoever did this just made this incision too far out. And but it's a fixable situation, but it's kind of difficult to fix. Okay, so another thing here for revision surgery, and that is residual fat. So if you look at this arrow, you can see this is a patient that already had upper and lower eyelid surgery, but they have this bulge. And that is the lateral fat pad, which is, especially for beginning surgeons, that's kind of the hardest fat pad to reduce. And you will see a lot of people walking around that have had eyelid surgery, and either the surgeon wasn't experienced or just missed it or didn't take out enough fat. And it can happen. Again, we're going to go back to the thing of a conservative surgeon, because you can always go back and take out a little bit more. And to be transparent, this is my patient, and I did upper and lower blepharoplasty, but I undercalculated that fat pad. So the patient came in, we made a little incision inside with a laser and removed that excess fat. So sometimes you have to go back and do revision surgery. That's just part of being a surgeon. This is called PIH, or post-inflammatory hyperpigmentation, and you see this with laser resurfacing, and this is usually on patients that tan real easy, or patients, people that have darker features, brown eyes, brown hair, and this is one reason why we don't laser patients, which we call class 4 or 5 or 6 Fitzpatrick skin types, which would include Hispanic, Asian, African American, Mediterranean sometimes. People that have pigmented skin, tan real easy, they will have a higher incidence of hyperpigmentation. It's temporary. We use bleaching cream and it goes away, but you can see everywhere that we made an incision or that we lasered here, we have this brown pigmentation. It usually lasts, usually don't see it for about a month. Right about 30 days it pops up. Patients, are a little unsettled by it, but it's a temporary situation. I've never seen it be permanent. All right, Festoons. I did a video earlier um, this week. It's on YouTube about what not to expect from your blepharoplasty surgery. And one of the things I talked about was difficulty of treating festoons. And festoons are this little swelling that's kind of not your eyelid and not your cheek. It's that junction between your lower lid and your upper cheek. And but sometimes you don't have festoons before your surgery, and then after your surgery you have these little pooches, okay? And that's because the eye has so many veins and arteries and lymphatics. There's a lot of things that move fluid back and forth. And when you do eyelid surgery, it can kind of plug up or slow down your lymphatic drainage. And it kind of, you get this waterlogged tissue right here. And this will go away by itself. Every once in a while, you'll see a patient where it's persistent. It could last even a couple months. But usually, it'll go away. You can laser this if you needed to, but it's something that, a patient may say, well, I didn't have this before surgery. And while I'm on that subject, that's why it's so important to take before and after pictures, because patients will come in sometimes and they'll say, you made my left eye bigger, or my left eye was higher and now it's lower, or, you know, it was this shape and now it's that shape. Although eyelid surgery can, change the shape of your eye a little bit. Generally, it's not a huge change. Um, and, a patient, our memories can be short, and you go back and look at the before pictures and show the patient that they, in fact, did have that situation preoperatively. So that's why pictures are hugely important for surgeons and patients. So this is kind of a rundown of the common complications that people see after blepharoplasty surgery. It certainly doesn't encompass every single complication, but it's the more common things that you see. As I said at the beginning of this, most of these things are absolutely harmless and will heal with time. You just have to remember the eyes are so sensitive, and that's why, if you get hit in the eye, you get a black eye, your eye swells shut, pink eye is painful. Um, the eye is just a very sensitive organ, and um, when we operate on it, we may have some of the things I discussed. Once again, I want to say that these severe complications, such as retroballbar hematoma, vision problems, or vision loss, these are very, very rare, and most surgeons would never see that in there. I want to say that these severe complications, such as retroballbar hematoma, vision problems or vision loss, these are very, very, very rare, and most surgeons would never see that in their lifetime. So I hope that I have maybe relaxed some patients that had eyelid surgery and they're a little worried. But again, I will once again emphasize, if you have a problem, you talk to your surgeon. That's the important thing to do. And if you're considering eyelid surgery, it's one of my favorite procedures. And like I said, I've done almost 7,000. So I have hundreds or maybe 1,000 pictures on my website of before and after cases of eyelids. So you can look at that at lovethatface.com. And once again, I'm in Richmond, Virginia. We see about 60% of our patients are from out of state or out of town, and we're set up to make it safe and easy. So I hope this has been helpful, and thank you so much, and have a great day. I'm Dr. Joe Nyamtu. Thanks for the greatest gift of all, which is your time.